Things with this technique, right? So your thrust is going to come like this. It's going to be, right, the example they give is like your monkey fart, right?
That's what Talia just said.
Okay. The other thing for people who like come from colder climates, right? It's like I'm scooping.
It's you're snow shoveling.
The snow shovel or the snow over my shoulder. Yep.
That resonated really good.
Because you're going to scoop with your short lever, and then you're going to dump it over your shoulder with your long lever. But again, they're working together. Okay. So once again, we're going to be off to the side because we need to come around the table, which would be poor mechanics for our cradle grip, where we would be at the head of the table and we have more of our kind of like monkey cymbal grip. So I rest the head down, I rotate it on, don't fold the ear, they won't thank you for that. I get my bicep, my finger, forearm, bicep, and boob. I make sure that I'm like control, no, don't help me.
Sorry.
So I need to have control over head and neck without my short lever. Okay, so do I have enough control to add in all levers? Okay, so can I rotate? Yes. Can I side bend with my butt wiggle? Yep. And then can I side shift? Yep. I feel pretty confident there. Okay, so then my short lever applicator is going to come onto the occiput. Okay, so if I'm going high, here's my C0-C1. Here's my C1, C2, my atlas. And then here's my mid and or lower cervical. Same thing, except for the placement of my short applicator and the arc of my motion. If I'm going high on the cervical spine, I'm there versus there versus there versus there. If I'm doing my lateral break, I'm going to couple it with flexion, and then it's going to be that, right? Where it's like this, almost like I'm snapping that pencil, versus my rotary technique is more like this, okay? As you get more comfortable, you can really get a lot of pops when you combine them. So it's like a rotation, and then you add in just a little bit of a lateral flexion with the long lever. Finally, the quick onset and the hard arrest of the movement will give you additional cavitations. So you spin the ball, you stop the ball, and then the cervical spine continues to rotate under the ball. Okay, so again, I get my long lever control, I rotate. Okay, so free rotation about 30, no more than 45 degrees. Short lever applicator comes in high on the occiput. Okay, so then I add in my side bend, side shift, PA shift, where the chin comes up into the air. I feel out my barriers. Patient feels a little relaxed, and then we go high arc of rotation.